Hey guys, welcome to Medifaction. So today we're going to learn about the anatomy of mediastinum. So what is a mediastinum? It is nothing but a membranous partition between two organs. So the organ which we choose today is the lungs. So let's learn more about the mediastinum in between the lungs. In this video, I'm gonna enumerate an introduction about the mediastinum in which we covers the boundaries, and moving on we will be learning about the divisions of mediastinum in which we will be discussing the superior mediastinum and the inferior mediastinum, and finally we will also correlate some applied anatomy based on mediastinum. Let's begin. Introduction. Mediastinum is the middle space left in the thoracic cavity in between the lungs. Its most important content is the heart enclosed in the pericardium in the middle part of the inferior mediastinum, or specifically the middle mediastinum. Above it lies superior mediastinum. Anteriorly and posterior to the heart are anterior mediastinum and posterior mediastinum respectively. The mediastinum is the median septum of the thorax between the two lungs. It includes the mediastinal pleura. Boundaries. Anteriorly, we can see here the sternum. Posteriorly is nothing but the vertebral column. Superiorly, we can observe the thoracic inlet. On each side, we can find out mediastinal pleura. Divisions. For descriptive purposes, the mediastinum is divided into the superior mediastinum and the inferior mediastinum. The inferior mediastinum is further divided into the anterior. Right here you can see the anterior, the middle and posterior mediastinum also. The sternal angle anteriorly and the lower border of the body of the fourth thoracic vertebrae. This is the T4 or the fourth thoracic vertebrae, and this is the sternal angle anteriorly. The inferior mediastinum is further divided into three parts by the pericardium right here. The area in front of the pericardium is the anterior mediastinum. The area behind the pericardium is the posterior mediastinum. The pericardium and its contents form the middle mediastinum right here. Now let's learn in detail. Superior mediastinum. The one right here in orange color is the superior mediastinum. Anteriorly, we can see the manubrium sterni. Posteriorly, we can observe the first four T4 vertebra, that is the upper four thoracic vertebra. Superiorly, we can see the plane of thoracic inlet, this one. And inferiorly, an imaginary plane passing through the sternal angle right here in front, and the lower border of the body of the fourth thoracic vertebra behind. So this dotted red lines are the imaginary plane I was talking about. This separates the superior mediastinum from the inferior mediastinum, and on each side we can also appreciate mediastinal pleura. Contents of superior mediastinum. We can see the trachea here and esophagus. In muscles, we can observe the origins of sternohyoid, sternothyroid, and lower ends of longus colli. In arteries, we can appreciate the arch of iota here, the brachiocephalic artery right here, the left common carotid artery here, and the left subclavian artery next to it. Talking about veins, we can observe the right and left brachiocephalic vein. Right here, this is the right brachiocephalic vein, this is the left brachiocephalic vein. And we can also see the upper half of superior vena cava, that is right here. And we can also appreciate left superior intercostal veins. In nerves, we have vagus, phrenic nerve, which supplies the diaphragm, cardiac nerves of both sides, left recurrent laryngeal nerve, the thymus gland, the thoracic duct, and also we can appreciate lymph nodes, which are paratracheal, brachiocephalic, and tracheobronchial lymph nodes. Inferior mediastinum. The inferior mediastinum is divided into anterior, middle, and posterior mediastina. These are the altogether contents of the inferior mediastinum roughly. So let's learn in detail about all these three partitions. Anterior mediastinum. It is a very narrow space in front of the pericardium, overlapped by the thin anterior borders of the both lungs. It is continuous through the superior mediastinum with the pretracheal space of the neck. Boundaries. Anteriorly, we can observe the body of sternum. Posteriorly, it's nothing but the pericardium. Superiorly, imaginary plane passing through the superior mediastinum from the inferior mediastinum lies. Inferiorly, it's nothing but the superior surface of the diaphragm. On each side, we can also observe the mediastinal pleura. Contents of anterior mediastinum. We can observe the sternopericardial ligaments, lymph nodes and lymphatics, small mediastinal branches of the internal thoracic artery, and the lowest part of thymus gland, and some areolar tissues, fats, etc. can be observed in the anterior mediastinum as contents. Let's move on to the middle mediastinum. It is occupied by the pericardium and its contents, along with the phrenic nerve and the pericardiophrenik vessels. The boundaries are: anteriorly, it has the sternopericardial ligaments. Posteriorly, it is bounded by the esophagus, right here, then descending thoracic iota, and also azygous vein. On each side, we can appreciate the mediastinal pleura. So this is how the middle mediastinum looks like. These are the contents. So this is the same pic. If you want to see the larger pic, you can move on to the or observe the previous slide. So let's explain the contents. As we know, the heart is enclosed in pericardium. The arteries present are the ascending iota right here, and also pulmonary trunk like right here, and we can observe two pulmonary arteries. In veins, we can see lower half of the superior vena cava. This is the superior vena cava, and we can see the terminal part of azygous vein, and also right and left pulmonary veins. This is the left pulmonary vein, this is the right pulmonary veins. In nerves, we can appreciate the phrenic nerve and also deep cardiac plexus. Lymph nodes which present here are tracheobronchial nodes, and some tubes are the bifurcation of trachea, the right and left principal bronchi. Now let's move on to posterior mediastinum. Boundaries. Anteriorly, we can appreciate the pericardium, bifurcation of trachea, pulmonary vessels, posterior part of the upper surface of the diaphragm. Posteriorly, we can appreciate the lower 8 thoracic vertebra and intervening discs. On each side, as usual, it's mediastinal pleura. Contents of posterior mediastinum. There is the esophagus and the arteries. We can observe the descending thoracic aorta right here and its branches. In veins, we can appreciate the azygous vein right here, the hemiazygous vein, and also accessory azygous vein. In nerves, we have the vagi, the splanchnic nerve, greater, lesser, and least, arising from the lower 8 thoracic ganglia of the sympathetic chain. Lymph nodes and lymphatics. Posterior mediastinal lymph nodes lying alongside the aorta, and also we can see the thoracic duct right here. Now let's discuss about some applied anatomy. The prevertebral layer of the deep cervical fascia extends to the superior mediastinum, and it is attached to the fourth thoracic vertebra. An infection present in the neck behind this fascia can pass down into the superior mediastinum but not lower down. The pretracheal fascia of the neck also extends to the superior mediastinum where it blends with the arch of the aorta. Neck infections between the pretracheal and prevertebral fasciae can spread into the superior mediastinum and through it into the posterior mediastinum. Thus, mediastinitis can result from infections in the neck. There is very little loose connective tissue between the mobile organs of the mediastinum. Therefore, the space can be readily dilated by inflammatory fluids, neoplasms, etc. In the superior mediastinum, all large veins are on the right side and the arteries on the left side. During increased blood flow, veins expand enormously, while the large arteries do not expand at all. Thus, there is much dead space on the right side, and it is into this space that tumor or fluids of the mediastinum tend to project. Compression of mediastinal structures by any tumor gives rise to a group of symptoms known as mediastinal syndrome. The common symptoms are as follows. Obstruction of superior vena cava gives rise to enlargement of veins in the upper half of the body. Pressure over the trachea causes dyspnea and cough. Pressure on esophagus causes dysphagia. Pressure on the left recurrent laryngeal nerve gives rise to hoarseness of voice or dysphonia. Pressure on the phrenic nerve causes paralysis of the diaphragm on that side. Pressure on the intercostal nerve gives rise to pain in the area supplied by them. It is called intercostal neuralgia. Pressure on the vertebral column may cause erosion of the vertebral bodies. The common cause of mediastinal syndrome are bronchogenic carcinoma, Hodgkin's disease causing enlargement of the mediastinal lymph nodes, aneurysm, or dilation of the aorta. Hope you have understood the video. Like, subscribe and press the bell button for more videos. Thank you. Thanks for watching.